Thank you for joining us. My name is Michael Quagg. I'm the Executive Director of the Community-Based Research Center, or CBRC. I'd like to acknowledge the land that we're meeting on today, the traditional and unceded territory of the Huron-Wendat, the Haudenosaunee, the Anishinaabe, and the Mississaugas of the Credit First Nations. For those unfamiliar with our work at CBRC, we are a national organization dedicated to promoting the health and well-being of people of diverse sexualities and genders. We do this through a variety of projects and initiatives, but our primary work is grounded in community-led research, knowledge sharing, and intervention development. In other words, we're committed to communities being empowered to unearthing deeper understandings around the health and well-being of 2SLGBTQI+ people in Canada, and making sure that information is used to improve health outcomes in our communities. That mission takes our work in so many different directions, but this morning we're here to talk about an area of increased relevance and importance in our work and in the healthcare system more broadly, and that's mental health. Gone are the days when we believed mental health was an issue for just a handful of people. Today, we recognize that each and every one of us have mental health needs and challenges, pressures that make us more anxious, more depressed, less hopeful for the future, or less able to enjoy the things that once brought us joy and purpose. And while that's true for everyone, many queer, trans, and two-spirit people endure those pressures at higher rates, and often for longer and with more serious consequences. This should not be a revelation to anyone. There's an obvious connection between one's mental health and the challenges that queer and trans people face as sexual and gender minorities, including rejection from family, bullying and harassment, discrimination and prejudice, feeling like you're living in the wrong body, or that you can't live openly as your authentic self. For these and so many other reasons, 2SLGBTQI+ people experience higher rates of mental health issues than their straight, cisgendered peers, and that impacts their overall health significantly. We're more likely to struggle with depression and anxiety. We're at greater risk for eating disorders and problematic substance use. Queer and trans people, and especially youth and young adults, are more likely to attempt suicide. This has been the unfortunate reality for too many queer people for decades, but today's announcement comes at an inflection point. Pressures on the mental health of queer, trans, and two-spirit people continue to mount, and the COVID-19 pandemic specifically dealt such a blow to queer communities. As people who rely so deeply on our chosen families, it's important to recognize how 2SLGBTQI+ people were uniquely impacted, including some who are isolated from each other for months on end, and some being confined in environments unaccepting of their sexual orientation, gender identity, or expression. Queer and trans-led businesses, services, and events that once were safe spaces and places to come together were suddenly closed. Some of them permanently. It became harder to find work, find support, and find community. And as we've continued to deal with the impacts of COVID-19, we've seen a rise in explicit hate and violence, especially targeting trans, non-binary, and gender diverse people. There have been enough cases in Canada to know that this isn't just an American issue. Many trans and gender diverse folks are reporting feeling less safe, and that deals serious impacts to their mental health. But while queer people often face greater mental health needs and challenges, our communities have a rich history of coming together to support each other and to organize around issues that impact our health and well-being, including our mental health. This project is an ambitious endeavor to uncover this knowledge, build skills and capacity, and ensure that we are mobilizing the policy and practice interventions necessary to uplift the mental health and well-being of queer, trans, and two-spirit people. To ensure that 2SLGBTQI+ community members, leaders, and organizations are at the forefront of mental health change and progress in Canada, and to lay the groundwork for a future where we are better equipped to look after our own mental health and well-being. I'm so glad that Minister Bennett and the federal government have recognized the value of this work, conducted by queer and trans people, and in partnership with so many other community-led groups across this country. And I want to give the minister and her team immense credit for grasping the urgency of this issue impacting our communities and supporting the scale of this project. And that brings us to today's announcement and the exciting next step these efforts are bringing to better understand and mobilize the information, knowledge, and interventions necessary for strengthening the mental health of our communities. So with that, I'd like to invite Canada's Minister of Mental Health and Addictions, the Honourable Carolyn Bennett, to the podium to share more details. Thank you.
Thank you, Michael. That was lovely, and I too want to acknowledge that we are gathered on the traditional territory of the Mississaugas of the Credit, where of course we acknowledge all of the Indigenous peoples who paddled these waters and whose moccasins walked these lands. And I often think that in terms of what some of us learned in medical school around the medical model and waiting for people to get sick and then try and patch them up, that the medicine wheel reminds me every day about how it was about finding that balance mentally, physically, emotionally, and spiritually, and being able to help one another stay well throughout the life cycle. And so it is pretty exciting to be able to start Mental Health Week here with all of you, and to be so warmly welcomed, Michael, by you and Dr. Brennan, and of course Dean Williams. It's suis heureuse d'être ici en ces débuts de semaine de la santé mentale, et je tiens à remercier l'Université de Toronto de nous accueillir ici aujourd'hui, de même que tout le monde du Centre de recherche communautaire. It is really for more than 20 years that you here have been making a positive and significant impact on the 2SLGBTQIA plus communities from coast to coast to coast. And I think in our conversation just now, to realize that even though we're here in downtown Toronto, that the work that you do is affecting people in your community coast to coast to coast, and that is how I think we move forward. We thank you for all the work that you are doing to support the health of people of all sexualities and genders through research and the development of interventions, as you've said, by listening to the community and really being able to respond to their questions and their concerns, but also hearing their solutions as to quite often that they've got the ideas of things that'll work, and then you get to go and prove that they work. And so I just think that this idea of the need for those safe and affirming spaces, as you said, that where there's a trust, where you can have those kinds of conversations about what people need and how we would best be able to go and respond to their needs. It, you know, as Professor Brennan said, that it is about meeting people where they're at. It's I think what people in your fields in social work have been saying for a very long time, that we have to meet people where they're at, not expect them to come to us, because a lot of people in racialized and the queer and trans community and gender diverse communities have not had a good experience in the traditional healthcare systems. And so this is I think very exciting to hear about how you put the public, how we put your public back into public health, and how we do the kind of transformative care that we heard that actually changes the system. And wraps it around the individual, and how, you know, I think when we were talking about and what the dean had said, that I was thinking of the placards out after the death of George Floyd, where people say the system isn't broken, it was built that way. And I think that we actually need now to be rebuilding bottom up. I was saying that, in the fight for Women's College Hospital, we were fighting for doctor to interdisciplinary, hospital to community, patient at the center of their care, the social determinants of poverty, violence, the environment, shelter, equity, education. And now I think we're on the brink of that real transformation, which does have public and individual people with individual needs at the center of their care, and that we're going to have to change the system. And we hope that the kind of resources that have been put to provinces and territories, but also the need for them to have an action plan that will do, as you say, what we have to have the data to see who is being left behind, who isn't getting the care that they need, who isn't getting that response that they have needed. And so as we build a new system that listens to and learns from people with lived and living experience, that can, like you, Michael, become from a peer support to actually this amazing academic who is going to prove the concepts that governments need to respond to in terms of what works and what doesn't work and needs to stop. So as we enter Mental Health Week, it's a great week where we raise awareness about the importance of mental health and encourage Canadians to reflect on mental well-being, because mental health is health. We often talk, this month we'll go to the WHO and the World Health Assembly, and I'm always reminded that it was a Canadian, a war veteran, Dr. Brock Chisholm, who was the first Director General of the WHO, where his words about there can be no health without mental health. And so that this mind-body piece that somehow got fractured, where all of our jobs is to just get it back together. And so it is really fitting that this year's theme of Mental Health Week is my story, and how amplifying some of the voices and spaces within mental health exists across Canada, where we can encourage more people to share their mental health stories and feel that they're not alone. But I think just sharing their stories is not enough anymore. We actually need to hear what they believe worked, what didn't work, and where they were let down by the system that wasn't listening, and what we then need to do to repair the system or actually remake it in a way that will be there for generations to come. So, as you know, I mean, one of the things that we're saying is that the pandemic was awful. It was awful for the mental health of almost everyone, but that it is. I think that what we're hearing is that it maybe was a little bit easier for people to admit that they weren't doing that well, that their mental health had been impacted. Maybe some admitted they were using substances more, but there just seemed to be a little bit more sharing about people's own struggles, which I hope will have taken the stigma down a tiny bit, to be able to let people continue to be able to feel comfortable talking about their feelings, talk about their mental health. And it is so important that when we talk about barrier free, that we have to get that stigma down, and that and yet we know stigma isn't the only barrier to care. We need systems that actually work for people. And so as you know, to the impacts of discrimination, racism, the two-spirited, lesbian, gay, bisexual, trans, and queer, the 2SLGBTQIA plus communities are statistically more likely to experience poor mental health outcomes, as you said, Michael, and when compared to the cisgender or the white 2SLGBTQIA plus people. relever ces défis et rendre les soins de santé mentale plus accessibles à tous est une priorité essentielle pour notre gouvernement. It is why we're proud to invest in community-based organizations like yours, which are doing this important work of breaking down these barriers and encouraging people from all walks of life to learn and talk and reflect and engage with others on all issues relating to mental health and mental illness. So today, I am very pleased to be announcing that our government is providing $2.8 million to the Community-Based Research Center to promote positive mental health in the 2SLGBTQI plus communities across Canada. They will do so through their Investigators, which I think is pretty special, community leadership program, which seeks to enhance mental health knowledge, capacity, change behavior, and improve the mental health outcomes of 2SLGBTQI plus individuals and communities. With this funding, Investigators is being scaled up to reach 13,000 2SLGBTQI plus individuals through the CBRC's 6 regional partners right here in Toronto at CRUISElab, but also in Edmonton at the Queer and Trans Health Collective, Montreal at CRUISElab, Winnipeg at the Village Lab, Halifax at the SHAG Lab, and Vancouver at the Health Initiative for Men. Le centre travaillera avec ses partenaires afin d'offrir une nouvelle version du programme qui intègre des méthodologies de recherche et des connaissances autochtones afin de joindre plus efficacement les communautés de personnes aux deux esprits, aux moyens d'information et d'intervention en matière de santé mentale qui soient sûrs sur le plan culturel. So today's announcement builds on our investment in budget 2023, including our investment of nearly $200 billion over 10 years to improve the healthcare services for Canadians, reduce surgical backlogs, support health workers, and improve integrated mental health and substance use care. It was interesting, Michael, to hear you talk about surgical backlogs and how that actually has affected your community as well in terms of gender affirming care. And so that this is mind, body, spirit, and I think that as we look forward to the action plans from the provinces and territories, that again, we will need everybody's help in really determining what are the indicators that will help us determine that no one's being left behind. So as Canada's first Minister of Mental Health and Addictions, we are all committed to ensuring that people in Canada, no matter who they are, who they love, have the mental health supports they need in their day-to-day lives. So through COVID, we learned that we can be apart, but not alone. And we've come a far way in shifting the conversation around more people to share their story, seek help, and heal. And we have much more work to do. This fund really was to be able to fund the research, to deal with the communities most disproportionately affected by the pandemic. And so I'm just thrilled to thank the Community-Based Research Center for leading this exciting new project. En travaillant ensemble, nous construirons un avenir plus fort, plus sain et plus résilient pour tous les Canadiens. Thank you. Merci, Miigwech. And now it's time for Dr. Brennan.
Good morning. Thank you, Minister Bennett. Good morning. I'm very, very happy and grateful to be able to be here as a guest on the land of my Indigenous colleagues and their ancestors, particularly those from the Huron-Wendat, the Haudenosaunee, and the New Credit. The COVID pandemic and its intended need for the isolation that was required to keep us all safe required shutting down and cutting back on many programs and services, and particularly programs and services for 2SLGBTQIA+ populations who already needed additional support and access and coverage. So the outcome of these cutbacks of these programs and services for meaningful connections further exacerbated already well-documented health disparities. The pandemic has profoundly affected these communities. These are communities who have worked, by the way, diligently for decades, if not centuries, potentially millennia, to build places and programs and opportunities for connection, for social connection, for building of meaningful relationships and community development, and addressing our own health, and particularly mental health and substance use issues. However, those connections required, those services required particular types of social connections. So the social isolation, the social fragmentation, and the disconnection, we know has already had its long-term impacts on the mental health and well-being of 2SLGBTQIA+ people across Canada. In Canada, we're rightfully proud of our human records of advancing queer and trans rights. However, we also understand that there are many areas in which we must continue to proactively work to support, empower, and build capacity for these communities to fully thrive. Again, in the context of sometimes very isolating, painful, and traumatic experiences. Many people, especially those who are marginalized based on their age, younger folks, older folks, or gender identity or expression, their indigeneity, race, their abilities or disabilities, their socioeconomic status, their housing status or geographic location. That list could be very long. So there are many other factors, but especially those folks have had very different experiences as a result of the COVID pandemic. Imagine, if you will, a young queer or trans person who had to leave what might have been a very supportive, safe school with peers and friends and teachers and supports, only to be locked into a home where family members were homophobic, transphobic, and sometimes violently so. What do you think happened to those folks? They didn't stay at home many times. So the impact and the long-term impact on their health and wellness, particularly their mental health and wellness, is very, very profound. The pandemic also hit many racialized immigrant and Indigenous communities much harder than others in Canada. And many from those communities are also, of course, 2SLGBTQIA+, and they were even more disconnected from the social fabric that helped them live their best lives. However, there are solutions, and we're very grateful today for the opportunity to hear about this funding, which has provided a very strong foundation for solutions. Minister Bennett and the federal government's announcement today puts Canada's commitment to 2SLGBTQIA+ mental health and wellness solutions front and center. The focus on community engaged mental health initiatives is a critical lifeline for 2SLGBTQIA+ people. We know already from all the research we get to do in my research lab, the CRUISElab, here at the Factor-Inwentash Faculty of Social Work, my colleagues, we know that there are better chances of better mental health outcomes if researchers, policymakers, government, service providers work with and for the communities to build opportunities for members of those communities to take the lead in our own efforts to develop programs, knowledge, resources, and policies that enhance our mental health and well-being. The Investigators program, it's hard not to say it without saying Investigators program, but it's to underscore the Y in the middle of it. The Investigators program is a tremendous success in this regard already. And we're very grateful deeply grateful for the government's support and for CBRC's leadership and support. These programs provide across the country hands-on community-led opportunities to learn more about how we address mental health needs in our queer and trans communities. What is the program? Basically, it's not that complicated. It's an opportunity for 2SLGBTQIA+ community members to come together with researchers, community leaders, academics, policymakers, artists, and providers to learn more about what is possible. Investigators participants are so committed to their communities that they volunteer their time to come to weekly sessions where they learn more about the history of mental health in queer and trans communities, and they seek ways of addressing those concerns through research and program planning. How do we do that? Also very simple. We ask the participants what they're interested in learning and knowing and what they think are possible answers. And then we work very hard with them to try and put together those solutions for them, for all of us in the queer communities. It's really kind of have goosebumps because it's really a vital and exciting program. In our program here in Toronto, many participants have already become leaders in 2SLGBTQIA+ health across Canada. We have former investigators who are physicians, teachers, lawyers working on all levels of government and the legal system, policymakers, community providers, mental health and substance use providers, executive directors of agencies, researchers, academics. But mostly, what's most profound is we have people from these programs who have taken this sense of community and civic engagement and leadership, along with the power of knowledge, to work to build a better world and to lead in ensuring that we have access to needed resources and support for 2SLGBTQIA+ mental health and wellness. And with that in mind, I'm going to pass the microphone over to Jack. I hope you will listen to Jack's story. Jack was an investigator during the middle of the pandemic when we had to pivot. And he is one example of hundreds that have been served by this program and thousands yet to come. Jack.
Thank you so much, David. My name is Jack, and I was a participant of the Investigators program. When I initially heard about the Investigators, I was a recent graduate from McMaster's Psychology, Neuroscience, and Behavior program, but I was working full-time at Costco, and I felt stuck. I had an idea that I wanted to work in healthcare, and especially healthcare that supported the queer community, but I didn't quite know how to get there. The Investigators was actually the perfect launch pad. In Toronto, the program was focused on gay men's health, but cohorts in other cities are focused on the entire LGBTQ+ community. In Toronto, I was able to learn about research methods and practices like epidemiology and qualitative research skills, as well as issues that were pertinent to gay men's health, like HIV prevention and the social determinants of health. And thanks to the Investigators' education, I had a tangible understanding of how research could be used to benefit queer people. One of the ideas I particularly valued learning about was community-based research. The idea that research about communities should be done with instead of on communities. Historically, researchers have exploited and harmed the people they studied because they weren't always operating on behalf of the people's best interests. But in community-based research, the well-being of the people studied is of the utmost importance. This philosophy resonated with me because it could act as an ethical and practical guideline for conducting very important research on vulnerable communities. What I learned through the Investigators is highly relevant to my current research, which is focused on supporting people with dementia and their caregivers. In addition to the skills and knowledge I gained, the Investigators also introduced me to a community. I met mentors who are directly engaged with gay men's health research, and I met peers who were in the same boat as me, young, chill, queer guys who just wanted to use science and research to help other queer men and queer people in general. In hindsight, I was so lucky to form these relationships during the peak of the pandemic. When the world was socially isolating, my peers and I formed a virtual queer book club where we were able to connect and learn about literature and issues that were facing queer people. These connections reinforced my mental wellness, and I'm so grateful that those friendships continue to exist today. I'd like to conclude by saying that programs like the Investigators are increasingly necessary today, as hatred and discrimination of queer and especially trans people is rising. As a queer person, I grieve for my trans friends. I want the best for them and everyone else in my community. And I think the best can look like access to affirmative healthcare. It can also look like solidarity, love, and support. So I'm so proud to be associated with the Investigators because I think they practice and teach those values. Thank you so much. I'll give it back to Michael.
Thank you, David and Jack, for those comments and for your great partnership in this work that we're talking about today on mental health and beyond. And thank you again, Minister, for not just championing better mental health outcomes for queer and trans Canadians, but putting real resources behind this because they are necessary. There's a frequently used adage in mental health supports and conversations, which is that two things can be true at once. It's often said to help people struggling with intrusive negative thoughts that we need to reframe the conversations happening in their own mind. You may have done something bad, but also you're worthy of love and happiness. You can be in a hard place right now, but also the future has capacity for change and growth. I bring this up now because in my opening remarks, I spoke about the hardships queer and trans people are going through and how we're experiencing disturbingly higher rates of mental health issues because of it. That's all true, but also our community is resilient. As a queer and trans person, you are part of a legacy of organizing and action, a history of fighting against oppression and for a better life. So our community is suffering, but also we are strong and capable. And that's what this funding is really about. It will empower us at CBRC and amongst our partners to continue doing the work we've been doing for nearly 25 years in researching and unearthing insights around queer and trans health. It will create more opportunities for queer and trans people in communities across this country to build their own capacity for research and knowledge sharing. And thinking about the experience from Jack is just such a wonderful and beautiful story around how important that journey is. It will connect to us LGBTQIA+ people looking to better understand and respond to mental health needs taking place within our own communities, demystify and destigmatize conversations around mental health, and generate a community-led and data-driven foundation upon which we can build real, effective mental health resources. So this funding is monumental, not just because it will enable us to go deeper into the research we've already done and better share that information, but also because it will foster an even greater sense of discovery and community-led solution building within queer and trans communities. Tomorrow's queer and trans mental health researchers and advocates are out there, people like Jack. And this investment will help us engage and find them even sooner. Of course, none of that would have been possible without CBRC's partners, people who have already been walking in step with us on this journey and who have come with the resources we need to foster this next wave of queer and trans mental health research and knowledge sharing. People like David Brennan and the CRUISElab at the University of Toronto, Dr. Olivier Verlat at the CoLab at Université de Montréal, Dr. Rusty Suleimanov and the Village Lab at the University of Manitoba, Dr. Matt Neumer and the SHAG Lab at Dalhousie University, and organizations like Health Initiative for Men, Queer and Trans Health Collective, and Two Spirits in Motion Society. And a final thank you to the minister, her team, and the federal government for their leadership and support. This is just one way We can work together to help queer and trans people live healthier, happier lives, but it is an important one we're celebrating. On behalf of the entire team at CBRC and those of our project partners, I appreciate the faith you've placed in our efforts. We'll use this support to continue our mission to support this and strengthen the mental health of the 2SLGBTQI+ community. Thank you, and we look forward to taking any questions.